Matthew Holt, I don't know what gigantic piece of healthcare news to be focusing on right now. Do we open with A, the new president who just got elected, who's going to tackle the greatest pandemic of our time with science? B, do we talk about the Supreme Court taking on a case about the biggest piece of healthcare legislation of all time, the Affordable Care Act? Or do we talk about C, the vaccine that was developed to help eradicate the greatest pandemic of all time that's proven to be more effective than we even expected it to? I don't know where to start.
How about we do D, the impact of said pandemic on all those digital health stock portfolios, including the ones that you and I bought some of.
The Teladoc that I got bamboozled into thanks to that big merger? Yeah, why don't we start there? It's the November 10th episode of Health in 2.0.
So it's great news by all accounts.
It's not great.
Well, it's not great.
No.
Millions and millions of lives are going to be saved. We're going to be back to normal if this vaccine works. 90% effective. So they got out of the clinical trial early. Pfizer stock going up by like a rocket. The stock market, Carnival Cruises, and all those guys have gone back.
We would not even be here having this conversation if masks were not a political issue. Okay, let's just go back to that.
I think you're just upset. I was just upset about the fact that the Teladoc stock that we all bought went down.
We did not buy that stock, for the record.
I did. I bought it because you told me to.
I bought it and sold it a long time ago. Love those folks at Teladoc, and now I have more Teladoc, but this Teladoc I didn't buy. This got converted.
Well, I think it's all a bit overdone. There is going to be room for, whatever people say after the pandemic, there's going to be room for telehealth and continuous care. I don't give up on the continuous clinic idea. But yeah, that merger looks a bit worse today, given that the stock market, the punters, the Robin Hood folks looked at it. They saw it as telehealth. They thought it was like Zoom. They sold. And all those property, companies are going up like a rocket, admittedly from having been 90% down. All right. So if you didn't get Pfizer, well, never mind. It's hopefully great news. Hopefully the pandemic may be under control in a year or so, maybe. But we'll have to find out later. Okay. Meanwhile, there are deals and deals. Ready?
You just transitioned yourself. Good on you. All right. Speaking of big news, Affordable Care Act darling Centene has made an acquisition. They've acquired Apixio, which has raised a total of $50 million. What is this going to do, and how is it going to prevent them from tanking if things go south with the ACA? Tell us, Matthew Holt.
I'm not sure Apixio will help them stop tanking. Centene will certainly tank if the ACA goes down because it's basically a Medicaid plan. So going to be a tough one. Apixio is an interesting company, been around quite a long time. And it's one of these companies that, yet again, does natural language programming to extract information and data out of clinicians' notes with used for coding. I'm not quite sure why Centene bought it, other than they're thinking about they need to do more better understanding of what's going on with their patient population. So we shall see. Hopefully that will help in the world of post-ACA Medicaid, better population care. But of course, yes, I think if you're holding Centene stock, got to be a bit careful what the Supreme Court says, but we won't find out till early next year.
Defensive move. Okay. What about Koa Health? Instead of being acquired, they actually spin out of Telefónica. That's a Spanish telecommunications company. And they raised $16.5 million in an A as they do that spinning. So tell me about this one.
Yeah, it's another behavioral health digital therapeutic. Who the hell knows what it's going to be? Quite often these big spin outs from these different big corporations are a bit weird and take a while to get going, but they usually start with a lot of money, some of which they waste. We'll see how they do.
All right, what about Echo? They get $65 million in a C round. This is an electronic connected stethoscope and ECG.
Built by a bunch of kids out of Berkeley, very smart guys. It's kind of like not more than the EK Junior Apple Watch. It takes, and I think more and more people will have one of these in their home one day, but certainly it's the new thing the professionals are going to start using. So interesting.
All right, what about Medically Home? They raised $40 million. This brings their total up to $65 million. This is another continuous clinic play as far as I'm concerned. Is that my rooster?
The rooster's back. Okay, well, there's the rooster. So medically home, yeah, I had them on. I met them pretty early on. They were incubated within Atrius, which is a fully capitated medical group in Boston. Had them on stage where I actually played an old person using them. I helped Tupelo a couple of years back. Lovely team, Chief Medical Officer Pippa Schulman. Interestingly enough, they've done a bit of a change. So they were initially for capitated medical groups, trying to help them reduce people. It's a hospital at home model, all the stuff you need to be at home, to be admitted to home, where they for 30 days will manage your progress, and it turns out to do it cheaper and better than if you were actually admitted to a hospital bed. What they found is since COVID, they've actually become like a sort of secondary surge capacity for hospitals, especially for non-COVID patients, because you may want, if you have COVID patients in the hospital, you don't want other people to be in the hospital who don't have COVID. And they've actually done a good deal with Mayo Clinic, so they're building out with them as well, and a bunch of other teams. So very interesting company. I think this whole continuous clinic of where do you keep people under surveillance and manage their care wherever they are is going to continue on for a long time, as you know. We've been spieling about that for quite a while, and Medically Home is certainly one of the companies that's thinking about while doing that. So I would expect to see a lot more growth in this area, and good luck to them.
Well, this is one of those that, like, luckily for them, they're not on the stock market right now because of today with the vaccine, because they would have taken a hit.
Well, I mean, it's one of the bigger things we want to talk about is what is this going to mean to hospitals in the end, right? Because a lot of them were projecting, they were coming back somewhat with their revenue, projecting that they weren't going to have, emergency rooms, so they're going to have a tough next year. Look, this is going to go on because, you can be a cruise line, an airline, whatever you like, or a hospital or a doctor's office. Yeah, eventually, if this gets sorted out, people will get back into the swing of things. However, don't forget, we have however many months there are of the pandemic raging, which is still going on, number one, right? And you talked about Biden right at the start and his new team. It's going to be 74 days before they're allowed to get the keys back. They give them the keys to the car to actually do anything. God knows what lunacy is going to happen in the next 70 days. Then you've got to figure out, okay, the Pfizer vaccine requires like really cold refrigeration, which doesn't exist in distribution. So someone's going to build that, and we'll get it done, but that's going to be a big deal. So how long is it going to take before you really can get that distributed and produced and all of it for the rest of the people? We don't know what the other vaccine trials look like. Some of them have been allegedly promising. It's the first one we heard about. And then, of course, the last point here is, great, so now everyone's got one of these things and everyone's going to get immunity. Does it actually work for the next coronavirus that's coming, or do we go back into this phase again? So, do we really go back to normal? Or now we've learned all this stuff about how we can live not normal, does that change the world going forward? I suspect it probably does. But
what is normal, Matthew Hulse? What is normal these days?
Well, I mean, it's the new normal is not normal.
I hate the new normal. I want a new normal.
Yeah, I mean, for you and me, you want to get back on a plane, go to a conference and have a drink somewhere. I'm very hopeful this is working out.
Truly. Well, yeah, lots to keep our eyes on. So we'll just have to keep watching there.
What a week. I mean, what a day.
God,
I mean, between Saturday's news of the Biden win.
How irate do you think Trump is that this vaccine thing got announced today?
Oh,
if you're Pfizer somewhere, somebody's like, why don't we hang on to that? Release that on Monday.
Oh man, I think no, seriously, Anish Goka, who's one of my right-wing doctor friends on Twitter, has been going. Eric Topol, right, wrote to all the drug companies and said, don't apply for the emergency use authorization for your vaccine until you are ready, and don't rush your trials to do that. Looks like they kind of rushed it a bit because this was supposed to go through to the end of November or whatever. Like they brought it forward because it was so positive, it was 90% effective. They did so well. But I mean, a lot of people are saying, oh, this is Eric Topol and his gang of liberal lefty scientists deliberately slowing this down because, had this news come out
last
week ago
on Monday, we may be looking at a completely different situation.
Might have been very different. Well, I don't think on Monday because the Republicans got a massive turnout on the day.
Oh, that's true, on
Tuesday,
election
right?
day.
And all the Democratic votes that won were mail-in votes that had gone previously. But maybe it had been a month before. Maybe there had been a vaccine. By the way, we don't know it's done yet.
Let's just put this in the pile of conspiracy theory that's out there. There's so much out there. What's this one more? Why not?
Yeah, that's another one.
All right, I'm getting us out of here. For more conspiracy theories, please follow along on Twitter because we love conspiracy theories, especially me. I'm at Jess Tomasa. I like the ones that are involving of like scandal. If it's got scandal in it, I'm there. Most conspiracy theories do, but then this guy likes at Bolty Boy, follow him for these really heady ones that often involve like the history of telehealth in Canada and so on and so forth. Digging through poll results to try to undermine and understand what's happening with voter turnout in like the most like remote counties of what was the one you made me look at with you? New Hampshire?
Maine. Maine.
Yeah, that was like 20 minutes of my life I'm not getting back. But if you want to waste that time, at Bolty Boy on Twitter is the place for you. And to make sure that you never miss an episode of Health in 2.0, be sure to sign up for our email newsletter over on thehealthcareblog.com. We've got these shows. Oh yes, there it is. Plus WTF Health interviews and a number of different stories that are pulled from the blog each week. It just arrives in your email inbox on Thursdays, so you can waste your time into the weekend. Mr. Holt.
Mr. Massa, we probably won't have a news day quite like today tomorrow, but we should see.
Oh, I can't wait for tomorrow. We'll see you guys. Bye.